Hello and welcome. I'm Vishal Dahiya and you're watching our special show India Fights Back, where we talk about the battle against COVID-19 pandemic. Now, the government will roll out the next phase of its COVID-19 vaccination drive from 1st of April to cover all those above the age of 45. Special focus will be given on optimum utilization of the capacity of COVID-19 vaccination centers while minimizing the wastage of vaccines. Now, the decision also comes in the backdrop of at least half a dozen states, Maharashtra, Punjab, Karnataka, Gujarat, Madhya Pradesh, and Tamil Nadu, reporting a surge in daily new COVID-19 cases. Now, the countrywide vaccination drive was rolled out on 16th of January, with healthcare workers getting inoculated and vaccination of the frontline workers started on 2nd of February, followed by those above 60 years of age and above 45 as well, but with comorbidities from 1st of March. So today we're going to talk about this new segment of the population, which will be the focus as far as the vaccination drive is concerned from 1st of April, how it is going to be done, what all do we need to know about it. And for more on this, we're joined by a distinguished panel. Let me first introduce them to you, beginning with Professor Gupta, who is joining us. He's member of NEGVAC, that is National Expert Group on Vaccine Administration for COVID-19. We also have with us Dr. Raman R. Gangakhedkar, member of the National Task Force on COVID-19, and Dr. C.G. Pandit, National Chair in ICMR. Welcome, both of you, gentlemen. Let me begin with you, Professor Gupta. Let's start by learning more about this, new turn in the COVID vaccination drive with focus on those above 45 years of age. What all do we need to know? What all does our viewers need to know about this new phase of vaccination drive?
There are three important points which our viewers must know. The COVID-19 is spreading again. I would say that can be called as a second wave, and you have seen that the 6th state which you have mentioned, Maharashtra, Punjab, Karnataka, Gujarat, Madhya Pradesh, Tamil Nadu, there's a high surge, and there is no evidence that there cannot be transmission from these states to other states. It may happen, and therefore, number one, that every citizen of the country has to be careful and use COVID appropriate behavior. Another important thing is, we have to ensure as wider vaccine coverage as possible. The first phase has been done. That means the frontline worker have been vaccinated. Then those who are above 65 have been vaccinated. Then the third was 45 with comorbid, with diabetes, hypertension, and all those comorbid conditions. Now we are trying to include all those who are above 45. Important thing is that our resources are not such that we can afford any wastage, and therefore each and every vaccine dose is precious, and that's what we call as an optimization of vaccine. That if any vaccine is left and is open, and we have to ensure that this goes to a needy person, and therefore we have a larger pool of 45 years population. To make it simple, it's just that you have to register in government centers, identified centers, and so many centers, the private hospitals which have been designated. It is not so cumbersome. People may say that हमारे पास तो mobile phone नहीं है, I am not tech savvy. For them, it's also easy that you dial a number and then you will be connected with an hospital and then you get registered yourself. Alternatively, not very distance from anybody's home, there are the centers which are located. You go there, register, and then get your vaccination registration done.
Okay, okay. Before I go to Dr. Gangakhedkar, one more question here, Professor Gupta, is for us to understand it better, because this age group between 45 and 59 years of age is approximately around 20 crore in our country. The question is, why focus on this particular age group specifically? The rationale behind us moving down from 60 years of age group to those above 45 year with comorbidity, and now everybody above 45 years of age.
I say that there's a very simple logic behind that. The people with the senior age group with comorbid conditions, they are more vulnerable because the infection fighting capacity, immunity is low, they have concurrent diseases, and therefore, if they suffer, the possibility of high morbidity and mortality is more, therefore, they need first. And before that, of course, they will be the healthcare worker because they are a highly possibility of exposure. Then is those which are having comorbidity and they are younger, means they are 45 plus, but the comorbid condition, therefore they are vulnerable, but less as compared to that. And then comes the next generation, less than 45, because more than 45, because we consider that they are immune. Nobody is perfectly safe. They can also be affected. But as compared to the ABC, which has already happened, they are less, but they are also. So we are exposing our population to the vaccination at this stage. And maybe after this is done, we will go to the next stage where each and every population which is eligible otherwise, not contraindicated in whom, will get a vaccination. So it is perhaps the fastest possible vaccination drive in such a large country in such a systematic manner.
Okay, okay. Dr. Gangakhedkar, we would like to, seek your views on the whys and hows of this next phase of the vaccination drive, which focuses on the, age group of 45 plus, irrespective of comorbidities.
Yeah, 45 plus. I think there are two issues, as Dr. Gupta tried to tell the audience. One thing which is that you want to reduce wastages. That's one major aspect that will happen, because of late again the kind of vaccine hesitancy that we are seeing is a little on the rise in last 3-4 days. Now, one of the ways is you increase the age group and try to ensure that they come, because that will reduce the wastage. The second issue, as he kept on saying, that we have to ensure that the population that is most vulnerable, as much as we worry about chronic morbidities, one must also remember that increased age in itself is one of the independent variables which are associated with severe COVID disease as well as mortality as such. So it is important to do that we need to ensure that we go right down up to 45 years of age. But at the same time, one must remember the message should not be that the people should not feel that those who have been left beyond 45, those who were actually to be part of that first 30 crore population that we talked about, and we know that the coverage is perhaps close to about 25% or so, the remaining ones have to necessarily go and try to take the vaccine, because they have far higher risk of severe COVID disease as well as mortality. And given the fact that 6 of the states are showing an evidence of upsurge of this infection and such a rapid rise that perhaps you cannot prepare the health system so easily. So one of the things which they should carry in their mind, the earlier I take the vaccine, the better it would be, because I tend to get some kind of protection far later, because you need to take 2 vaccines, 2 dosages to actually get protected after some time of receiving the second dose. So to me, the message is also very, very clear that reducing that age to 45 doesn't necessarily mean that those who have not taken the vaccine should now think that it is additional group that is supposed to go which was not eligible, and they, even if they don't go, the government would not be worried. Government is
Okay.
worried about vaccine hesitancy. Those who required it must go and take it.
Okay, definitely, and that point which both of you are making, that is even the health ministry, Union Health Ministry has pointed out on Tuesday there that the situation is going from bad to worse as far as the second wave of COVID-19 is concerned. So obviously, it is really, really imperative that those who are eligible to get vaccinated should do so. And from 1st of April, it will be everyone above the age of 45. That brings me to another aspect here, Professor Y.K. Gupta, and that is, you're earlier talking about how optimization is really, really important here, reducing the wastage part. One, point which is also being talked about is that there will be a lot of renewed focus on how to bring more and more people under the umbrella of this inoculation drive. So what's the kind of strategy which is being adopted here to increase the numbers? Because as Dr. Gangakhedkar was also pointing out, as of now it's somewhere around 25 odd percentage points.
Now, if we make the coverage of 45 plus, it is approximately 20 crore population, which will be significant. Now, the important thing is that we must reach out to this population by media, by personal contact, by influencer group, that vaccination is important. And if you are eligible, you must go and get what Dr. Gangakhedkar has also said, and tell them that the registration is not at all difficult. There is no adverse event which should be worried. And then ask them to take an appointment. It's better to take an appointment because that prior appointment, prior fixing will make the organizer at the hospital, at the center, do the program that how much vaccine injection to be brought, how much arrangement to be done, and rather than what is called an optimization, that if it is not done, then some of the vaccine centers will be khali and they will be underutilized, and some of the vaccine centers will be crowded. So it is going so systematically because it is all appointment based.
Okay.
And now we are opening that you go, even if you have no appointment, go and to the site and take an appointment. But it is always good that you phone and you make an appointment and then you fix up a time and go. That will help in zero wastage of such a precious vaccine.
Okay. Dr. Gangakhedkar, your views there on the strategy which is being adopted and what more needs to be done, not only to ensure that, we bring down the wastage, which was obviously, the numbers were very high in certain states, but also, tackle that vaccine hesitancy part which you're earlier referring to.
I think one good thing that will happen is it will reduce one component of vaccine hesitancy, where people tend to get worried, do I fit into that 20 diseases list, and should I go there, or will they say no to me? How do I procure certificate? All those hassles will be gone. So one component of hesitancy will definitely be handled by actually saying that anybody who's 45 plus can go. The second issue, which is also important, is the government has to come out with different statements. Now, government has to say, these days you tend to hear all kinds of stories that come through social media and news as well. Now, one of the recent news that is coming is anybody who is less than 55 and 60 in two different European countries, they have said AstraZeneca vaccine should not be taken. I think timely action to ensure that such news does not damage people has to be taken through issuance of a statement whereby you try to convince people that yes, we are asking you to take this vaccine, and the risk, if you feel that you could be taking at this juncture, is almost negligible based on the 6 crore people, over 6 crore people who have received these vaccine dosages today in India. But if we don't come out with those statements, the rapid response to such stories is extremely essential to reduce vaccine hesitancy. We remember that we heard about stories about those blood clots causing any damage to people. You suddenly found that people who were older, who had already some history of either a cardiac element or a neurological element where they had thrombotic episodes or heart attacks, they suddenly started worrying whether one should take it. Is it going to add to my risk by any means? But I think the way we have to approach this, it has to be little aggressive in terms of quelling this. Now, for social media, I think we, since last one year, 1.5 years, or whatever, we have understood importance of social media in terms of its ability to cause a damage, negative damage. I think now people have to start thinking, how will I use this particular social media to promote the health related messages in a strong way? If we don't do that, then we have not learned a lesson. The
Okay.
third thing, which is also critical for all of us, is mobilizing the community. When you start any vaccination drive, if there is no community preparedness, you will find that it becomes a prescriptive vaccine. Now, if you want to boost up vaccine eagerness, you need to prepare the community as to why you are doing, how you are doing, when. We need to ensure that community opinion leaders, which would have local relevance, they would come up and try to plead the case as to why community should come forward.
Okay, indeed, these two are seemingly very, very important elements. You agree, Professor Gupta, that community mobilization and an aggressive approach in terms of doing away with the rumors and then clearing the hesitancy part there as well. These are really significant elements of this inoculation drive, given the fact that this is an adult vaccine.
See, vaccine hesitancy is a known phenomena. It happens everywhere, every part of the world with the society. But in today's era, when the social media exists, it should be used for good, not for bad. And that is what the importance is, that when there is a vaccine hesitancy, the media should play a very positive role. The social media should play a positive role, giving the true picture, which is the scientific version, rather than giving anecdotal, hypothetical things and bombarding with the information, what nowadays we are calling as the WhatsApp university, giving the entire bogus news, half information, and this half-cooked information, non-scientific information, semi-scientific information, or you can say Ashwathama Maro, that type of language, which creates a panic, which creates disbelief,
Okay.
which creates lack of confidence. And therefore, it is important that we give the correct picture. When the government of India, the entire scientific community of India, the entire administrative is giving the correct picture that these vaccines which are introduced in India are safe, and therefore there should not be any reason to believe that this possibility, that possibility, and get carried away with that.
Okay.
I do not know whether we can prevent such type of WhatsApps by regulatory things, but it is important that the educated, understanding people should not forward such media which creates such WhatsApp which creates confusion.
Okay. Indeed, we all of us will have to, focus on the reliable source of information and check and cross-check before we share any piece of advice or information, not only about vaccines but otherwise in our daily course of lives as well. One more aspect here, Professor Gupta, before I move on to Dr. Gangakhedkar, is in terms of absolute numbers, and if you're looking at the larger picture here, these figures are really important, and they're big as well. Almost 6 crore inoculated so far, and this age group from 45 years to 59 years is around 20 crore of our population. Now, we have two vaccines as of now, Covishield and Covaxin. Will it help, and how much will it help in terms of covering more people once we have other vaccine candidates also getting approval? For example, Sputnik is one which is there in line. Apparently, its proposal is pending with the DCGI.
See, we have now Sputnik lined up. We have another with the Zydus is lined up. We have 2-3 more vaccines still in the phase. I feel when these vaccines will come as early as possible, perhaps we will have much more centers to open, and then this will be basically also available to each and every eligible candidate in the country, eligible population in the country. So it will be good that these new vaccines which are in the pipeline also come into as early as possible after due approval process, after examining their safety and efficacy. In the meantime, we have a reasonably good number of these vaccines available. There is no shortage at the time, because this requires a lot of management of vaccine centers, making them into the system of computer data system, which is now maturing day by day. Now we are able to handle more than lakhs and lakhs of patients into the computer system, and everybody is so meticulously recorded into the database that everybody is getting the reminder that now is time to come again for the second dose. So I think the other two vaccines which are in the offing will still make the things better.
Okay, definitely. With more vaccines out there, it will become easier to cover a larger chunk of the population. Let's have a concluding comment from Dr. Gangakhedkar here on, the reiterating the importance of getting oneself inoculated, specifically those who are in the age group of 45 plus, starting 1st of April onwards. Dr. Gangakhedkar, your final advice, word of advice to our viewers, specifically those above 45 years of age. Why should they go for it?
Yeah, they must remember that India is a country which has very high family values. If you want to protect your own older people in the household, the best way in this pandemic, which is threatening the lives of almost everybody, the best way to do it is try to ensure that your parents, your people who are older than 45 are actually provided with this vaccine. You would have done, as we tend to say in our own philosophy, that you would earn punya if you try to safeguard the lives of your elders and those who you love at this juncture. It's not necessary that all of us need to receive vaccine right away. But if we provide it to those who are most vulnerable, we would have almost made half the success that we would achieve while fighting this particular pandemic.
Okay, indeed, that sums up the rationale behind why one should go for it, both in social and philosophical terms, as well as very important, significant in medical terms as well. Thank you so much, Dr. Raman Gangakhedkar and Professor Y.K. Gupta, for your views and insight on this important aspect of the vaccination drive's next phase, which covers everybody above 45 years of age from 1st of April onwards. So if you're above 45 years of age, get yourself registered for the COVID-19 vaccine as soon as possible and go and take that jab. That's all on the vaccination drive so far. We'll come back again with a different aspect of the battle against COVID-19. But before we leave, let us once again remind you about the COVID-19 appropriate behavior as well. A simple 3-step process which involves Wearing a mask at all times when you're out there in public, ensuring that you wash your hands regularly. Hand hygiene is equally important, and so is maintaining physical distancing of at least 6 feet from others. Now, these 3 simple steps will go a long way in protecting you and your near and dear ones from the COVID-19 pandemic. Thank you.